Hi moms and dads, a warm welcome to another episode of Today's Parent, where we connect you with experts and provide you with information to make your parenting journey a bit more easier. I'm your host, Christine Kasina. In today's episode, we are going to talk about autism and ADHD. We've got a lot of questions from you, and today we have an expert, counseling psychologist Rosa Sanao, who is back to share with you information when it comes to autism and ADHD and how we can understand these two conditions better. Rosa.
Yes, Christine.
Good to have you back.
Thank you.
Welcome to the show.
I'm happy to be here.
Autism, define for us, please.
So, autism, simply defined, we can say is a neurodevelopmental disorder that is characterized by two things. An inability or deficit in social interaction by the individual, whether the child or the teenager, and the unusual behavior or characteristics. So by unusual, what I mean is they may be having repetitive tasks or behaviors and an affinity to sameness, that they want to stick to routine even where it is not beneficial for them. So they may be wanting to arrange, and it is not OCD, but they just want it arranged in a particular order, or they just have a thing of maybe these flowers.
Right.
It just stimulates them and it makes them relax or reduce their anxiety. So those are the two definitive characteristics of autism.
So when you talk about neurodevelopmental, it's something that happens in the brain. Is it a chemical imbalance, something that happens at birth? How does it come about?
So I think that's the causes, or how it comes about it's not an either or. We may not say it's just a developmental issue in the brain. So there are those that happens because of an imbalance or because of the brain formation, and then sometimes during birth, either because there was a birth complication before, during, or after.
Okay.
So it complicates their development, and sometimes coupled with environmental factors and social stressors that can aggravate or make the condition severe. So we don't just look at one specific cause, even though genetic and neurological factors play a big role, but it is not just a single cause.
So it could be genetic as well?
Yes, it could be genetic, but coupled with other causes.
Is there something that a mom watching right now, possibly they're pregnant, is there something that we can prevent during pregnancy to avoid getting autism? Or it's something that if it's going to happen, it will happen somehow?
Well, with our technology, I wouldn't authoritatively say that there is a definitive way to prevent while pregnant.
Right.
But with history taking and going for your clinics, you're able to know if it's probably something that has been in the family, even though sometimes it may not be hereditary, and taking care of yourself, because there are certain habits that sometimes tend to predispose either mothers and their children to certain mental illnesses, including autism. So I may not say that there is a preventive measure per se.
Right. I wonder what kind of habits, if you could share.
Smoking, drinking.
So increases the risk of autism?
It probably not autism per se, but it does increase, it may create birth complications.
Right, okay.
During delivery or after. Yes, because of the chemical composition of these drugs, or even drugs. So it's not just alcohol or cigarettes, but even other drugs. So this, because they introduce new chemicals into the body, and the mother is the one carrying the child, so it introduces new chemicals that may alter the chemical composition of the child.
Okay.
Yes, growing up.
Okay. What are the signs of autism in children?
So one, social interaction, that children tend to have a difficult time engaging with their peers. Now, as children grow up, one of the things that they learn between from the time they are 0 to 5 years, say, is social interaction. At different stages, they're interacting with a caregiver, which we call attachment, and they are learning how to communicate. They learn how to speak. They learn how to play with others. We teach them how to share. Now, this looks very simple and typical of children, but a child with autism will have an extremely difficult time. So a typical example would be, picture a 6-month or an 8-month-old sitting with their mother and playing. A typical child, when the mother leaves, they'll turn and probably cry and want to follow the mom. But a child who has signs of autism may just turn and look very oblivious, like nothing just happens, because they have a difficult time with attachment and the interaction. They don't get why it doesn't make them feel, let me say, emotional.
Okay.
Yes, because they have an emotional deficit. They are unable to maintain emotional contact, express themselves emotionally. So even when the mother leaves, they just don't know what to do. Not to mean that they do not love their parents or the people they relate with. They just have a difficult time expressing.
So they're not emotionally expressive.
Yes, that is one side. Then with repetitive behavior, they may be addicted, in quote unquote, addicted to repetitive behavior and an affinity to sameness. So they want routine, and it is routine that will disrupt their normal life. Like if they find that their shoe is not there, they may throw a tantrum. It will affect them significantly. For a typical child, they may just want their red dress, and when you convince them that we can have a blue dress, it's okay, they'll throw a mild tantrum. But for a child who may be having autistic tendencies, if it is the red dress and we want to wear it every day, there will be a more severe reaction, and they may want to have that kind of either eating the same food or doing the same thing at the same time in the same order every day.
So they thrive better with routine for sure.
Yes, and extreme
routine.
Extreme routine that will affect their day-to-day, because you may not have routine every day. Things change. But for them, they may not understand the aspect of things change. So it may be very extreme for them.
Okay. Okay. Any other symptom in children?
So in children, autism does co-occur with other ailments or other disorders. So apart from those two that are a criteria, and when we diagnose, we look at those two occurring at the onset, because autism can occur, earliest onset you can start noticing is 2 to 3 years. So when we are looking at those symptoms, we look at, is it occurring maybe with other sleep problems, intellectual disability for older children, physical ailments, because some autism does occur with epilepsy. So we look at different kinds of comorbidities or other things that may occur that we can relate to them, looking at the criteria. So we just don't look at random things and say, these ones are together, so they are autism. No. Speaking
of which, Rosa, are there different types of autism? Are there different levels?
So autism is not an either-or disease, like it's just autism. It is defined as autism spectrum disorder, where it occurs across a spectrum. So you may have one extreme of autism with intellectual disability, where a child is, like in a previous show we had talked about intellectual disability, where a child is unable to comprehend or develop their speech. So you have a child who has autism but has this particular intellectual disability. Then we may have children with autism that may have delayed speech or may be non-verbal. They may not be able to speak and develop their speech like typical children. We may have children who may be having moderate ability. So they do have the signs of autism, but their intellectual capability is as typical children. Then we have the other extreme of children who have super ability, that they do have the signs of autism, but they have exceptional abilities that we may call it genius, but sometimes because of a chemical imbalance that causes them to just act super extreme than other children.
Okay.
Yeah.
All right then. Let's touch on ADHD. Break it down for us.
So ADHD, it's an acronym for Attention Deficit Hyperactivity Disorder. And this is also, again, a disorder that is characterized just in the word attention deficit, that the child is unable to maintain attention for a certain period of time. So they find it difficult to remain attentive or still. And hyperactivity, where the child experiences impulsive behavior and it becomes difficult to maintain, let me call it order, quote unquote, where they have a difficult time doing things that typical children do, such as sitting still during class, and their attention span is a bit lowered compared to the typical children their age. So that is just what ADHD is all about.
Is it something, if a child has ADHD, even before getting them to the school level, enrolling them to school, is it something you can notice and find a way to manage it before you take them to school, or probably take them to a special school? What are the signs that parents need to look out for when it comes to ADHD?
Now, for ADHD, we will look at, coupled with the tools that we will give if a child is coming for diagnosis, and it is a multidisciplinary activity where I will not just diagnose alone, for example. I will have to have a psychiatrist and just have a whole colleagues that work together.
Okay.
But with the symptoms that I am looking out for, compared to a child her age or his age, how is their attention span? Now, we know children do have a short attention span, but when I am looking at this child, they are unable to maintain the social contact. They may be playing around, but their playing around is probably extreme in ways that they're either destroying things, or their hyperactivity. They have an impatience. For example, if we are waiting in line to toilet train, for them it is an extremely a task that they can't seem to hold. So you're looking at the extremes of attention and the activity that it causes them distress to have to wait, or to have to sit down and listen to rules, or to have to sit through an activity. And mostly how you can do that is probably even in their play. Art, when you give them something to draw, you find that they are unable to complete a small task.
Yeah. Like they give up.
It's too tiring to do the same thing and just follow that simple routine. They just feel like I need to be doing something else.
Okay. Is it a particular age? 4-year-olds, 3-year-olds, is it prevalent in a particular age group, or it's across, your toddler going onwards? Is it worse, for a certain age demographic, or?
Well, we wouldn't say it's worse for a certain age demographic, but it is diagnosed best in younger children, not probably 3-4-year-olds,
okay,
going onwards. And even in teenagers. So if we are diagnosing a teenager, we'll have to history take from the time they were toddlers. How were they doing? Because now for a teenager, how you will see it is they lose things that are supposed to help them, like schoolwork. So they lose their biros, their pens, or they'll do their homework, forget their books. And it is not once or twice. It is repetitive, and they're unable to sit still maybe in a class. Now, one thing to note is that sometimes when you are talking about school, sometimes children have a difficult time in school when we are talking about ADHD, not because they are not because they are intellectually disabled, if I use that word, but because of the inability to sit still. Okay. So if teachers and parents are able to find ways to help this child, it means that they are able to perform like other children. Because even some of the tests that we use need a child to sit still to complete the test. So because this child can't sit still, they'll probably score lower than other children. But it's not because their intellect is not up to standard, just because they can't sit still. So that's also a pointer for teachers. Create and find ingenious ways to help this child concentrate, rather than just saying, they can't come to school.
Absolutely. Yes. The one thing that you've said that is very interesting is that you can diagnose ADHD, autism later on in life, because we assume these are things you capture when they are younger, and then they just grow with it. So it's interesting that you mentioned that ADHD and autism can develop later on in life.
Maybe even not develop, but captured, because you may find that, especially in African society, we assume these behaviors are a result of bad parenting. We just say, this mother does not know how to contain their children. These parents are too lenient. Sometimes these diseases are seen as illnesses of the urban, that they just leave their children to their own way. So you find that before parents are able to actually know that my child actually could be having a disorder, the children has been beaten in school because of lack
and of course,
inattention.
Absolutely.
The child has been beaten because of failing their grades, falling back on their marks. So the issue is diagnosis, that it's caught later because parents have gone through, especially for those who are spiritual, they are taken for prayers, they are taken some rigorous things that even injure the child's esteem. because we are not aware of mental illness.
Right. All right, we're going to take a short break, and then when you're back from the break, you'll share more with us.
Thank you, Krista.
In today's episode of Today's Parent, we are talking about ADHD and autism. It's a question that many of you have asked, and I hope so far you're getting a better understanding from Rosa Sanao. We'll be back right after this break. Rosa, welcome back from the break.
Thank you.
And as we are coming from the break, we have a question that has come in from Werimo. And Werimo's question is, she's heard from a lot of her peers that getting a child when you're a bit older increases the risk of your child getting autism. Is that true?
Yes. So research has shown that women who have children in their later years, after 35, I may say that.
After 35?
After, or even just way later in their 50s, increases the risk. So it is not that it causes, because I do not want to create unnecessary panic. It just increases the risk of a possibility of autism. So not to say that don't go and have children, but it just and it doesn't have to happen, but it is one of the risk factors among the many. Now, some of the risk factors include something like genetic factors, people who are predisposed, traumas, stressors, environmental factors. These are just risk factors. Sometimes even relatives of children who have had autism or ADHD, children, it has been found that sometimes it runs in the family in a way. So these are just risk factors, not to mean that if you have a risk factor,
of course you're going to automatically get ADHD or autism.
But it is a risk factor age.
Okay. Okay. So let's look at management. How do you manage autism? How do you manage autism in children, even before we get to managing autism in much older children?
Okay. So there is no cure for autism. But like you're saying, with adequate management, children who have autism can go on to live very independent and very productive lives. Now, when we looked at the symptoms, we looked at inability to interact socially and the repetitive behavior that sometimes may be harmful, because you find that there are those who may have repetitive behavior like head banging if they don't get what they want. So that may cause them to have internal injuries. So when you're talking about repetitive behavior, some of them may have self-injury tendencies, especially in older kids like teenagers. So with management, we are looking at, number one, medication. Now, because sometimes to stabilize the moods, and some of them are put on antidepressants or psychotropic drugs that help.
But not small children, right?
Not small children, not small children. But some of them are just put on medication that helps to either stabilize their mood or help them to like ADHD, to remain still. Now, medication may not work alone, because we want to improve. You see, autism, we're talking about social interaction. So social interaction is learned. So in management, we teach parents on how to equip their children with social skills. So parents are encouraged to spend more time with their children, because you see, for a child with autism may not be able to return the affect and the emotion. So a parent may feel very discouraged, and they may feel like, my child doesn't love me.
So a parent shouldn't give up.
A parent shouldn't give up. And even where the child is not expressing the emotion, be assured that your child loves you and your child prefers you to any other stranger. They may not express it, but as they grow older, research has shown that children actually prefer their caregiver to any other stranger, even though they may not express it.
Right.
So management includes teaching social skills, teaching children how to interact with others. Management may also include speech development for children with autism and speech difficulty. So speech development, there is like an example of a parent who was helping their child learn. So the parent would speak and just speak to the child, and at the age of like 3 years or 4 years, the child had a vocabulary of 22 words, and that for them was exceptional.
That's amazing.
Because the child was nonverbal. So the thing about management with social skills is that the support system not to give up, and to be taught on the various social skills. Social skills can be taught through play therapy, art therapy, music therapy, because that one lessens anxiety. Because you see, inability to interact socially is aggravated by anxiety. So where the child feels anxious in a social situation, they now are unable to even function.
Okay.
But when you find ways to lessen their anxiety. Other things include psychotherapy with counseling, where parents and the support system are also helped to cope. Teaching children how to cope and improve their independence.
All right. I know we're running out of time, but I would want you to touch on ADHD as well. Management, how do you as a parent cope? How do you help your child cope?
Just like with autism, also management is very personalized. But now with ADHD, we are looking at improving attention spans or improving the attentiveness, attentive skills, and helping these children work through their assignments or finish through their assignments. So it is mostly about behavior therapy, or they may be put on stabilizers that help them now to kind of be still or be able to reduce the impulse. Because for them, you see, it tends to be more of an impulsive behavior.
Okay.
It's not that they choose, because again, the other misconception is that it's because you're parenting your children badly. Even for people who do not have mental illness or children with mental illness, please be kind to your fellow parents. When you see a child acting out at the supermarket, don't just assume that the parent is parenting badly. It could be a mental illness. So be kind, be patient with them, even just smile at them. Sometimes it's even in the awkward stares we give people, and they feel so judged and
Absolutely.
guilty for their children, and it's a condition. Like we said, it has no cure, just like autism. So for management, we are looking at behavior therapy, where we teach, because again, we say in psychology, behavior is learned and can be relearned. So we are looking at these behaviors of hyperactivity and being unable to sit still, lack of attention. Can we help this child learn other behaviors to cope? And then as they develop, because their brain is developing, it develops and they outgrow some of these things. And then they become better at coping.
Right.
Yes.
ADHD, can a child with ADHD attend normal school?
Yes, they can. With adequate management and behavior therapy, a keynote to point for teachers and maybe parents is that find ingenious ways to help these children concentrate. So probably their lessons may be scattered, but shorter. Instead of the whole 30 minutes, you could decide that for this child, I'll be giving them breaks. So they learn in between breaks, because that is their attention span. So create ingenious ways to help these children cope. Because again, sometimes putting children away from their peers, it also delays.
Yeah.
It delays their development. One of the examples, a case study that was done was of an older sibling who had ADHD, and the younger brother was a typical child. So as they grew up together, because he was unable to sit still, but as he saw his brother, he learned. He was just able to observe. And in his adulthood, he writes and says that as he observed, it kind of outgrew. He was able to.
Right. Thank you so much, Rosa.
Thank you, Christine.
Thank you so much for coming to share. We've learned a lot from you, and I'm sure for the parents who are watching,
Yes.
they have learned as well.
Thank you.
And with that, we come to the end of today's episode of Today's Parent, where we hosted Rosa Sanau, a counseling psychologist who has enlightened us on matters autism and ADHD. If you want more information, please send us an SMS and we'll be able to connect you with her or answer your questions in a different episode. She has mentioned something that is very, very important. You can get free diagnosis at KISE, Kenya Institute of Special Education. Feel free to Google them and see if you can find more information. I have been your host, Christine Kasina. It's been a pleasure having you. And we are here in studio, the home of fun, exciting, and durable kids furniture. This place is called Little Cribs. For parenting information, head over to www.supermamas.co.ke. We look forward to having you next time. Thank you for tuning in.